Welcome everybody to another edition of the Michael Costa Show. This episode will revolve around COVID once again. Yesterday we had another press conference by our government. Try to keep it nice today. With some of the key moments or important factors of the press conference basically was the region of Quebec that the elementary school students will be going back to school. And for the region of Montreal, for the island of Montreal and the island of Quebec, curfew will be going back to 9:30 as of next Monday. So I'll be moving from 8 o'clock, which it is now, till 9:30 starting next Monday, May 3rd. Okay, so let's get right into it. First of all, I just want to say off the bat that I really didn't appreciate Monsieur Legault laughing about that 54-year-old lady that passed away from thrombosis, from getting which is not what I'm saying. It's what Dr. Arruda, the public health director, and the Prime Minister said, that she died from the AstraZeneca vaccine of thrombosis. But anyways, when he was, a journalist asked him a question. I don't remember what exactly was the question, but I know the answer was, well, yes, there is a 54-year-old woman who was in good health. Then he looks at Dr. Arruda, and he's like, I don't know if I was allowed to say that. I might get in trouble for saying that. And he starts laughing. I don't see what's funny about a 54-year-old healthy woman dying from a vaccine. But I don't know. I guess people aren't as pissed off. Well, yeah, actually, I have seen some people speak out about it, post it on Facebook. So I guess it's not that everybody doesn't care, but just I wanted to point that out, that it wasn't really like the actions of a prime minister to laugh about a woman that died. But I digress. So from the Montreal Gazette, COVID-19 live updates. Curfew in Montreal and Laval moves back to 9:30 next Monday, Legault says. Premier Legault's announcement comes as Montreal reports fewer than 200 COVID cases for the first time since October 2020. Okay, so Montreal has its reports its lowest new cases numbers since October 2020. Well, that's interesting. What happened in October 2020? Oh, it's true. It was the second lockdown. Well, second lockdown. We never really left lockdown, but the return of the intensive lockdown. The 28 days to kill the second wave, which, by the way, is still ongoing 7 months later. So basically, Montreal has reported as fewer cases since that time, since we've went in this second intensive or severe lockdown, if you will. So basically, that was, I thought this was another article, sorry about that. So basically, that's what he said yesterday. So the big things were basically that Montreal will be going back to a 9:30 curfew as of Monday, May 3rd. So okay, so let's continue. Here in the New York Times, I wanted to just show you. I'm not going to read you the article because it's not like that important, but in the New York Times, which is which is a reputable newspaper, let's call it that. It says, the flu vanished during COVID. What will its return look like? So you see the red line on the graph here is the 2019-2020 flu season up until now, March 2021. right? The dotted line, well, that's the average of flu cases from 2015 to 2019. Right? So we did of last year have a lot of flu cases in March and April, in January, February of 2020. Then all of a sudden they dramatically started going down, like drastically, like straight line going down, which is usually doesn't happen in a straight line like that. So it coincides with when they started testing for COVID. Well, look at that. And then it just goes to zero from last summer to basically now. When usually, yes, obviously the months of the months of May, June, July, August, September, October are usually slow in the flu season. But then usually, like you see here, in November it starts going up, reaches its peak in about February, more or less, beginning of February, and then it starts going down, right? Well, miraculously, since the beginning of COVID, the flu has disappeared. So the coronavirus has ended the influenza epidemic. Or endemic if you want, because it comes back every year, right? There have been fewer influenza cases in the United States this flu season than any on record. About 2,000 cases have been recorded since last September, according to data from the Centers for Disease Control and Prevention. In recent years, the average number of cases over the same period was about 206,000. Guys, SARS-CoV-2 has ended the influenza type A and type B. About 2,000 cases have been recorded since last September, which is when usually the flu season is about to start, right? So from September to now, only 2,000 cases of the flu have been recorded in the United States. While in recent years, the average number of cases over that same period, from September to April, 206,000. So there's a discrepancy of 204,000 flu cases from normal years to this year. So, am I allowed to speculate? I don't know if YouTube will allow this. But my opinion, I'll go out on a limb on this, is that out of those average 206,000 flu cases a year, or during that second wave period, well, is it safe to assume, let's say it this way, is it safe to assume that out of the difference in numbers of 204,000 flu cases, is it safe to assume that some of them might have been counted as COVID? I'm asking the question. I'm not stating anything. All right. So let's continue. More from my stubborn push of showing you that lockdowns don't work. I've been saying it for a year, and I will continue saying it because of the lives that these lockdowns have affected. So from the Daily Mail, fully open Texas and Florida are reporting fewer new cases per capita than Michigan, Pennsylvania, and New York, where mask mandates and other COVID-19 restrictions are still in place. Data from CDC shows that states like Texas and Florida, which have completely reopened, are reporting less cases than Michigan, Pennsylvania, and New York. Pennsylvania, New York, and Michigan all have COVID-19 mask mandates in place. Michigan reported 390.2 cases of the virus per 100,000 in the last 7 days. Pennsylvania, 221.4. New York, 206.1. Texas health officials, on the other hand, have reported 70.4 cases per 100,000 in the last 7 days, while Florida recorded 186.8 cases per 100,000 in the last week. So guys, more proof. Texas and Florida that have been open. Florida, since in August is going to be a year that they're fully open. So they were a lot ahead of the curve in Florida. But Texas, which did it more recently, about 6 to 8 weeks ago, and people predicted a zombie I can't find the word now. Apocalypse. Sorry about that. A zombie apocalypse was going to happen, and that people were going to start dropping dead like flies in Texas. Even Dr. Fauci can't understand and can explain what's going on in Texas. Well, here you have it. While Pennsylvania, New York, Michigan all still have lockdowns and mask mandates in place, they all have double, or if not even more, in some cases even triple. In Michigan's cases, we're talking about 4 times more cases per 100,000 than Texas. In Michigan, where she said that even after vaccination, that even there will be no going back to normal, that certain sanitary measures will stay in place forever, the governor of Michigan said. Meanwhile, while her is still in lockdown, she has her state still in lockdown, and with mask mandates, Texas, that lifted theirs about 8 weeks ago, have 4 times less cases per 100,000 than Michigan. All right? And then people say, oh, but it's because when I point out basically that Texas and Florida are reopened and us here we're still locked down, people say, yes, but they're vaccinated over there. Maybe us, when we'll be vaccinated like that, we'll go back to normal. Bullshit. First of all, vaccination is going through all 50 states. So if that was the case for Texas and Florida, why is it not the case for Pennsylvania, New York, Michigan, and New Jersey, and all the other states where cases are continuing to either stabilize, not go down, or even rise? So, let me show you the difference in vaccination, right? So let's check Texas. So Texas here has given 37.2% of its population at least 1 dose. So we're about at the same percentage as here in Quebec, which last time I checked yesterday was at 38%, 1 dose, right? The fully vaccinated in Texas, so that has gotten both doses, we're at 25%. So 1 in 4 Texans have received both doses. But only 37% have received only at least 1 dose. Let's go check Florida. Sorry about that. So Florida, they're a bit ahead of Texas. They have 40.5% of the population that has received at least 1 dose, and 27.5% that are fully vaccinated. Now let's go check. These are the fully opened states with no mask mandates and no lockdowns. Now, let's go check the states with the lockdowns and the mask mandates in place, that where the cases are, the 7-day average of new cases is much higher than in those 2 non-locked down states. So let's start off with Michigan. Well, look at that. How interesting is that? Michigan has a bigger percentage of the population vaccinated, both with only one dose and both doses, than Texas and Florida, with 41.5% that have at least received one dose, and 30%, that means 1 in 3, that have received both doses. So they have a higher percentage of the population vaccinated, yet cases are still 4 times higher. New cases are still 4 times higher than in Texas. Explain me that one, folks. New York. Well, look at that. New York, even higher than Michigan. Given at least one dose, 45.9. So basically 46% of the population has received at least one dose. 32.2% of the population are fully vaccinated, meaning have received both doses. Yet cases keep going up. Pennsylvania. It's like I chose these ones from the least to the most vaccinated. Excuse me about that. Pennsylvania has 47.7, almost 48% of the population that has received at least one dose. And 30.2%, 1 in 3, are fully vaccinated. Let me check New Jersey over here because, sorry, this is New Jersey. New Jersey, even more. Or probably they have, if I'm not mistaken, I don't have time to go check right now to give you the exact number, but if I checked not too long ago, and if I'm not mistaken, New Jersey has the highest death rate per capita in North America, or at least in the States, for deaths by COVID. They have given 50, basically 49.9, 50% of the population has received at least one dose. 33.9%, basically 34%, are fully vaccinated, thus have received both doses. So guys, that whole argument about, because that's why Texas and Florida have less cases because of they have received, they are vaccinated, is thrown out the window. It's complete bullshit. Because as I've showed you with the article before, how Texas and Florida cases are drastically dropping, while Michigan, Pennsylvania, New York, New Jersey continue to go up or stabilize and are at much higher rates per 100,000 than Texas and Pennsylvania and Florida. So now we're starting to see this has nothing to do with the vaccination. Like why it is going down so much. It has to do with lockdowns. It's becoming clearer and clearer. And I don't understand how I could have seen this almost a year ago or a year ago. And yet, half of the people don't see this. Like I saw a survey this week saying that, done here in Quebec, in the province of Quebec, saying who are your most trusted news sources. And I think, I don't know the exact numbers, but it was around this. In the 20%, which is the highest percentage in the survey, went to LCN for their first choice, and second choice was TVA, Nouvelle. Like, excuse me, but they're the same source. It's the same newsroom. It's the same articles. And you said your first choice for getting your news is TVA, and your second choice is LCN? Like, is 1 in 4 people in Quebec that dumb? And I don't want to generalize. I don't know. I don't want to be mean. But, like, it completely boggles my mind when people say things like that, that you follow religiously what a TV is telling you, what a TV station is telling you, and then you tell me to do my research. Or you laugh at me when I tell you that I research these things. While you get your information from Paul Larocque and Diane Lamarche on LCN. And then to go confirm that information, you go see Mario Dumont and Emmanuel Latraverse on TVA Nouvelle. Come on. Obviously, here I've shown you how it's not about the vaccine, it's about lockdowns. In the New York Times, written by Markham Hyde. Mr. Hyde is a longtime health and science journalist who has written extensively about the microbiome. Can we learn to live with germs again? The health of our bodies and microbiomes may depend on society's return to lifestyles that expose us to bacteria, despite the risks. Our immune system, George Carlin once said, and it was perfect. He goes, your immune system is built to fight germs and bacteria, but it needs practice. It needs practice to work on little germs, little bacteria, so that when a real problem arises, your immune system is prepared to fight it, right? Doctors have been saying that for years, and now we can't say it. We might be censored by Facebook because we don't want to encourage people not to be alert for the coronavirus, for COVID-19, SARS-CoV-2, however you may call it, or SARS-CoV-2 is the virus itself. Comes from a family of coronaviruses, and the disease it gives is COVID-19. So don't come at me. I know exactly what it is. So basically, this is in the New York Times saying that we need to learn to live with germs again. Another thing I've been saying for a year. Mask requirements, which I repeat, to be clear, it's obviously like in school for the kids, it's completely dumb and shouldn't be a requirement. But I just want to be clear with you guys that mask requirements, like this piece in the Washington Examiner, shouldn't override basic human kindness. An April 16th incident on a Southwest Airlines flight shows the problems with mask fetishism, along with continuing evidence of the dying of common sense and the desperate need for COVID-related lawsuit protections. I'm actually all for mask wearing in enclosed places, but that's not the issue. Also, as the point here is not to bash Southwest or to litigate each specific aspect of the story as told by the passenger, but rather to make those broader points above. I have not asked Southwest for a point-by-point response to each element of that story. So, I won't read the whole article. It's just to show you the basic idea that these measures that the governments are putting in place shouldn't override our basic human rights. And that we should go back to learn how to be polite with each other. Or at least if you have nothing nice to say, don't say nothing at all. Like my mother used to say, right? So experts find more evidence, this is from Global News, COVID-19 is airborne and that we need to rethink indoor spaces. So like I've been telling you for months, This virus is spreading indoors. And the longer you are closed in the same indoor space, more chances you have of catching the virus. The authors of a new paper that found increasingly concrete evidence that COVID-19 is predominantly airborne say that we need to be focusing on preventing infections in indoor settings and rethinking how ventilation systems either help spread or dissipate the virus. A Lancet report published Thursday from epidemiologists and experts across both Canada, US, and the UK found an overwhelming amount of evidence that the disease was spread through aerosols, tiny airborne particles that come from people's mouths when they breathe, talk, or cough. Okay? So once again I ask, it is proven through study after study after study that the virus is spreading indoors, and the longer periods you spend indoors in the same closed space, the bigger the chances of you be spreading or catching the virus. So I ask once again, why does the government want us to stay indoors continuously? That's why in all these states where the lockdown measures continue, the cases continue to go up or don't go down because you're locked inside, so the virus has more chance of catching a host. Like, it's basic common sense. But if you go and say something without the sources or the science behind it to back it, like I do, well, they tell you don't know what you're talking about, you're not a scientist, you're not an expert. So that's why I try to have all these documented studies to back up what I'm saying. And in this case, like in many other cases and many other studies I've shown you, from the Lancet, with a very good reputation. This is a journal, Lancet has a very good reputation in the science world. And there, they tell you that this virus spreads indoors through tiny airborne particles that come from people's mouths when they breathe, talk, or cough. Ontario lockdown not supported by strong science, says former chief medical officer of health. The province's top doctor for most of the 90s says the Ford government's COVID-19 response is misguided. So this, not from me, this is from the province of Ontario's top doctor for most of the 1990s. A former chief medical officer of health in Ontario sent an open letter to Doug Ford on Monday, criticizing the province's lockdown strategy and backing up ousted MPP Roman Barber. Dr. Richard Chabas held a senior position from 1987 to 1997 and served as chief of staff at York Central Hospital during the 2003 SARS crisis. Lockdown was never a part of our planned pandemic response, nor is it supported by strong science, Chabas wrote. Chabas says that the COVID-19 modeling the province is working with a faulty, and that fatality rates have declined as doctors and scientists have learned more about the disease. Reasonable estimates of the infection fatality rate from COVID have been declining as we learn more, he said. Models that predicted hundreds of thousands of deaths from COVID in Canada were badly wrong because they used incorrect, exaggerated inputs. Chabas also voiced his support for the anti-lockdown letter that Barber sent to Ford last week, a letter that resulted in his expulsion from the PC caucus on Friday. MPP Roman Barber sent you a public letter calling on your government to change course on COVID, said Chabas. He made 5 key points, and I believe he was correct on all 5. Barber's letter called Ontario lockdowns deadlier than COVID, while claiming it caused an avalanche of suicides, bankruptcies, divorces, and takes an immense toll on our children. So as I've told you, so now, not only is the collateral damage from lockdowns very serious and very dangerous, through, like this doctor here is confirming, through suicides, bankruptcies, divorces, the fear of going to the emergency room, so people dying at home because they were too scared of going to the emergency room to catch this virus because of the fear mongering that the media and the government has done. But not only the side effects and the collateral damage that these lockdowns are doing, we now know, it is proven, that the more you continue these lockdowns, the more the cases go up, hospitalizations might go up, ICUs might go up, deaths might go up. So it's no longer only about the side effects and the indirect damage that these lockdown measures do. It's a direct correlation right now with new cases. Direct correlation. So if your jurisdiction has lifted mandates, mask mandates, and lifted lockdowns, cases going down. In jurisdictions where lockdowns are still in place and mask mandates are still in place, either stabilizing or going up. So I ask again, why is the government want to keep us indoors where they know it's more dangerous for the population? Asking the question, I want an answer. From the American Institute for Economic Research. Yeah, I know it's not a medical institution, but still. The lockdown paradigm is collapsing. It's taken much longer than it should have, but at least it seems to be happening. The lockdown paradigm is collapsing. The signs are all around us. The one-time hero of the lockdown, New York Governor Andrew Cuomo, has seen his support tank from 71% to 38%, along with even more demands that he resign. Meanwhile, polls have started to favor Florida Governor and lockdown opponent Ron DeSantis for influence over the GOP in the future. This remarkable flip in fortune is due to the dawning realization that the lockdowns were a disastrous policy. DeSantis and fellow anti-lockdown governor Kristi Noem are the first to state the truth bluntly. Their honesty has won them both credibility. Meanwhile, in congressional hearings, Representative James Jordan demanded that Dr. Fauci account for why closed Michigan has worse disease prevalence than neighboring Wisconsin, which has long been entirely open. Fauci pretended he couldn't hear the question, couldn't see the chart, and then didn't answer. Finally, he just sat there silent after having uttered a few banalities about enforcement differentials. The lockdowners are now dealing with the huge problem of Texas. It has been fully open with no restrictions for 6 weeks. Cases and deaths fell dramatically in the same period. Fauci has no answer. Or compare closed California with open Florida. Similar death rates. We have a full range of experiences in the US that allow comparisons between open and closed and disease outcomes. There is no relationship. You have here this chart. Total COVID deaths per million in the US states up to April 16th, 2020. Right? You see here, like, here's New Jersey with the highest, so I was right before. This is New Jersey with the highest death rate in the country. Then you have New York, Massachusetts, Rhode Island, Mississippi. And the ones with the smallest death rates, Hawaii, Vermont, Utah, New Hampshire, Colorado. Right? You have all these. So it goes from the lowest death rate to the highest death rate. So here, these ones, the highest death rates are mostly all lockdown states. So in the Toronto Sun, Levy, 3 prominent docs call lockdowns a waste of time. They've been called witch doctors and snake oil salesmen for daring to go against the prevailing groupthink about lockdowns and to challenge the preening, camera-hungry medical experts who don't represent the experience of clinicians and nurses on the front lines of the COVID battle. Just like the third marquee that you keep on seeing on LCN and TVA. But in a lengthy Zoom interview this past week, Paul Elias Alexander, Howard Tenenbaum, and Harvey Risch, all PhDs working out of prominent universities, told me flat out that lockdowns are a complete waste of time. Risch is a professor of epidemiology at the Yale School of Medicine, called them counterproductive. He said while lockdowns can reduce the numbers of COVID-infected patients, they only have a fighting chance when you can move every infected person out of a population. Once the lockdown ends, there are people waiting to be infected, he noted. Once an epidemic has spread widely in a population or around the world, there's no chance you can eradicate the virus completely, Rich said, adding that putting travelers in quarantine for 14 days is also a waste of time. This is all show. This is all theater. Alexander is a PhD educated in epidemiology who recently worked for the Health and Human Services Department in Washington, D.C. as a senior advisor on COVID-19 pandemic policy. Said they have a year's worth of data showing that there have been crushing harms from the draconian lockdowns. 3 experts. Well, let me rephrase that. 3 more experts confirming you what I've been telling you for a year, that lockdowns are a waste of time and that are now dangerous. Not only are they dangerous and have a correlation with the number of cases rising in certain states, well, we have here from the BBC, lockdowns hurt child speech and language skills report. Data from 50,000 pupils and a survey of schools across England have shown an increased number of 4 and 5-year-olds needing help with language. So not only is it dangerous with suicides, bankruptcies, divorces, cancers, the fear of going to the emergency room when you feel sick. Well, now we have even more damage that it's causing. It's causing kids, 4 and 5-year-olds, needing help with language, affecting their speech development. Ontario nurses, this is what happened. So now you have it. Doctors speak out, they are silenced by their orders or by the government or threatened. We have another case here. Ontario nurses claim they have been muzzled by college. The College of Nurses of Ontario allegedly threatening to yank license of nurses who don't stick to the COVID script. So if you dare talk about what you've seen at work, or if you dare to step a little out of line of the normal COVID narrative from the media and the government, well, you'll be punished by your order, by the College of Nurses in this case. See how the media, technical from the Washington Examiner, CNN technical director admits to pushing COVID panic and using death tracker to do it. Because when it bleeds, it leads. And that's the thing, folks. It's a shame, but it's like that. So what does CNN do? They push fear. This is very dangerous because now you have half of the population not wanting to leave the house. Like in this case, in the Globe and Mail, Emily Victoria Viegas, 13, is one of the youngest people in Canada to die from COVID-19. Now this is tragic, and I wish this little girl hadn't died. And my condolences, prayers, and thoughts go out to the family. But this title is not only alarming, excuse me, it's not only alarming, but it's dangerous because it instills fear. That's what they're trying to do. But it's also misleading because when they say she is one of the youngest people in Canada to die from COVID-19, they know that most of the people won't read the article. But when you do read the article, you notice that when she fell sick, the father didn't bring her to the hospital right away. Well, actually never brought her to the hospital. So let me read a bit of this to give you a bit of the context. Back at the apartment, Emily had developed a stubborn cough, but otherwise felt well. Well enough to engage in the moody sparring most 13-year-olds have with their parents. Mr. Viegas would tell her to stop playing Minecraft or texting her friends and do her homework. No way, she'd respond, often with colorful language. Get lost, old man. But after a week, as a fever came on and Emily's breathing became labored, their father-daughter exchanges shifted. Mr. Viegas occasionally noticed Emily struggling to inhale, which would cause her to panic, which would only make it harder to take in the air. It scared me, but I kept telling her, slow down, slow your breathing down, so you're not using all the energy you have to get air, he recalled. On April 22nd, Emily woke up in the bedroom she shares with her younger brother, went to the bathroom, and returned to bed, lying beneath posters of mermaids and characters from the film Frozen. Just after 9 a.m., Emily's brother noticed she wasn't moving and raced to get their father. Mr. Viegas found his daughter laying eerily still, her eyes partially open and completely unresponsive. He called 911 and was instructed to give his daughter CPR. When paramedics arrived, they cleared Mr. Viegas and his son out of the room and tried to resuscitate Emily too, and briefly got her heart beating again, but she still wasn't breathing. They tried again. After she was rushed to the hospital, a doctor called Mr. Viegas and said they would try once more, but if they failed, they'd pronounce her dead. 3 hours after Mr. Viegas had put his head on his daughter's chest, he got another call. She was gone. Doctors said she not only had COVID-19, but also pneumonia. So, she didn't die of COVID. She died of pneumonia with COVID. And the pneumonia only got worse by her father not taking her to the hospital or not calling the ambulance. So, to have in the headline that this girl is one of the youngest to die from COVID is completely misleading. She died with COVID from pneumonia because of a lack of treatment. And I'm not here judging her father, because the mother, her mother, the wife of the father, was in the hospital on COVID, and she was lacking oxygen. So I think she was on a ventilator. That I'm not sure. It mentions it in the article. So he didn't want to, I don't know, maybe he was scared, and I don't want to judge his judgment, but I'm just explaining that the fact of him waiting and not bringing her to the hospital or calling an ambulance may have caused more harm in his daughter. and she died. Not like the title says from COVID. She died with COVID from pneumonia, like it says, buried at the bottom of the article. That's what they do, because they know people don't read the articles. So they put it in the title, big fear, because when it bleeds, it leads. They know people, obviously, it's a young girl, 13 years old. Nobody at that age should be passing away. They know it's going to affect people and it's going to touch people's hearts. So they put that in the title so you get even more scared, right? That's what it is. So, what are we going to do? Right? I just want to show you something before I end this today's episode. A few things I want to talk about. First of all, I want to say some positive things, right? So these are Canadian, this is Canada numbers, not Quebec, all right? So this is Canada, the whole country. Currently infected patients. We have 84,239 currently infected patients. Out of those, 82,884, which is 98%, have a mild or no condition. 1,355, so that's 2%, of infected patients are in serious or critical condition. And in the recovered cases, right, the people that have had it but no longer have it, which is 1.1, okay, let's say the numbers. 1,107,939 cases which had an outcome. Out of those cases, 1,083,874, 98%, recovered, discharged from the hospital. Out of the 1.1 million, 24,065, 2% have died. So even though any death is a tragedy, we also can look at the positive. Sorry about that. We also can look at the positive and say that 98% of the people that are infected right now are in a mild or a mild condition or have no symptoms. And out of the people that have recovered, or the cases that are no longer counted, 98% have recovered, 2% have passed. So that's the good news, at least. We could talk about, instead of only talking about the 2% of the 2% side, negative side, we could talk about the 98% positive. At least I think so. So, this Saturday, let's get into the interesting stuff. This Saturday, big protest starting on Sherbrooke and Davidson. We are going to walk. We are awaiting 25,000, maybe even more, because there's buses coming from across the country, across the province. We are going to walk on Sherbrooke to Viau, go up to Rosemont, come back down Bourbonnière, and finish at the corner of the Olympic Stadium, P9 and Sherbrooke. It's going to be, if you are against these measures and want to get back your life, I strongly advise you to show up to this protest May 1st, Saturday at noon at the Olympic Stadium, corner Sherbrooke and P9. It's very important that we show the government how our power and strength and numbers is very important. So, any of you out there, if you are against these measures, are fed up of how the government is managing this pandemic, and want to get back your life, You got to show up on May 1st, this Saturday, at noon, at the Olympic Stadium. Let's send the government a strong message that we are fed up and we will no longer stand up for these dangerous lockdown measures that are literally putting people's lives at risk. I will be right after this video. I will be signing up as a member of the Conservative Party of Quebec, the PCQ, because they are the only party that are publicly against these lockdown measures. Because it is not normal that 46% of the population here in Quebec oppose these lockdown measures, and not one MPP from the Quebec Parliament represents these 46%. Not one. Nobody in the four parties representing almost half of the population that oppose these measures. So the only party that publicly and has in their program opposed these measures is the PCQ, led by their new leader, Eric Duhem. I will be signing up as a member to their party, and I will try to volunteer knocking on doors. So the voice of the 46% that oppose these measures are heard, and they deserve to be heard. So I won't tell you to sign up. I just wanted to let you know that that's the party. If you oppose the measures, that's the only party in Quebec Parliament or in Quebec politics that represents your point of view. Nobody in Parliament is representing your voice. So you want to make your voice heard? Those are the people that are representing that percentage of the population. But even more importantly, is show up Saturday if you oppose these measures. You show up Saturday, and we show the government how united we are and our strength in numbers, that we oppose these dangerous measures, and that if they don't change course and adapt, that we will do everything in our power to take them out of government. That's my message for you guys today. Don't forget, May 1st, Olympic Stadium, corner P9 and Sherbrooke at noon. See you there. Thanks for tuning in, guys. See you soon.